Hello everyone, this is HM1 Abreu, and this audio-visual guide is for your medical assessment skills and how to increase your chances of not missing anything. The medical assessment skill is about 15 minutes long, and this is the only skill that you're allowed to have a cheat sheet. This audio-visual guide is here to help you better understand what needs to be in your cheat sheet and what does your cheat sheet really mean. So let's start. I'm just pull up my share screen right here, and we'll talk about what needs to be on your cheat sheet. Your cheat sheet, you're going to be given 2 minutes from the time that you're before your assessment starts. So that 2 minutes is, you should take that opportunity to write everything down. So what needs to be on there, HM1? Well, your scene size up doesn't need to be on there because I expect you to know that easy step. BSI's my scene safe, my nature of illness is, my number of patient is, I will have additional help on standby. I will consider C-spine stabilization but not take it this time. What do I see, hear, or smell? So those are a standard script that you should know at this point. So what else needs to be on there? Well, you need to have your patient's age on your cheat sheet, okay, their sex. You need to know your primary assessment, G, L, C, A, B, C, T, P, and I'll talk about that here shortly. Then your secondary assessment, O, P, Q, R, S, T, and your ample, and a clarifying question, okay? The next one is your second half of your medical assessment will have your focused physical exam, your baseline vital signs, and you're going to have the first set of vital signs will come from your actual patient, and the second one will come from your scenario. So what are the vital signs? Blood pressure, pulse, respiration, CTC, and ICE. Oops, sorry, ICE. And then we're going to come up with our field impression. We're going to call medical direction for permission to intervene and transport. And then you're going to provide your intervention, whatever you came up with. After that, you're going to reassess your VIPs. We'll talk about the VIPs here shortly. And then you're going to give your verbal report. So this is what needs to be on there. Well, when you're giving your verbal report, there are only several components that needs to be on there. So in addition to this, I want you to mark your the following with stars or circle it. So these items will be the ones that you only need to read when it's time for you to give your verbal report. You don't need to read the whole thing. So what needs to be read on there? There should be your age, your sex, the level of consciousness of your patient. What was their chief complaint? Okay, what's important on here on the OPQRST? So all of this right here needs to be mentioned, or not all of it, but what's important on the OPQRST part. Sorry, have problems just highlighting those things right there. So I'm just going to put an asterisk on there. You also need to mention something about your past medical history. So your ample, okay, like I said, only what's important, doesn't have to be every single one. Then you need to say, what did you find on your focused physical exam? Okay, on this focused physical exam, what did I find? You need to give me the baseline vital signs from the scenario, okay? And then you're also going to give the intervention that you provided. And then you're going to the reassessment vital signs that you're going to provide. Obviously, you are going to ask what your blood pressure, pulse, respiration, CTC, and eyes were. Okay. And then the intervention, that would be basically, how did your patient do? How are you feeling? Okay. That's an important thing for your report. So all these the ones that with stars on here, those are the ones that you need to read to when it comes to your verbal report. So let's talk about this one by one. So on here, the age and sex, this will be given to you when you're given a scenario. You have a 45-year-old male who is experiencing dyspnea. So you write down their age and their gender. And then Your G stands for the general impression of your patient. You need to indicate whether this part right here is well or poor. Okay, those are the two things that you're going to identify on your assessment, well or poor. Okay, for level of consciousness, this is the part where your patient, you're going to ask the 3 questions of your patient. What is your name? Where are you? And what time is it? A and O times 3. So A and O times what? 1, 2, or 3. And before you do this, by the way, before you do this level of consciousness right here, you want to make sure that you introduce yourself before you ask those 3 questions. A lot of you just jump right into there. So please make sure you introduce yourself before you ask the 3 questions for A and O, alert and oriented times how many, okay? Just want to make sure that you guys understand that. Then you have your chief complaint. How do you get this chief complaint right here? Well, this chief complaint, you're going to get this by asking the patient, why did you call us today? Whatever they tell you, you're going to write down exactly what they told you. Do not change anything that the patient says, okay? That's a big no-no right there, okay? Then you have your patient's airway. If your patient is talking to you, the airway is open. If they're not talking to you, then you open, clear, and secure. So again, if they're talking to you, you just have to verbalize that my patient is talking to me, the airway is patent. Okay, if it's not, then you're going to open the airway using whatever maneuver, head tilt, chin lift, jaw thrust. You're going to clear the airway if there's obstruction by suctioning no more than 10 seconds, and you're going to secure using an OPA or an NPA. After that, you're going to jump right into the breathing. You're going to expose the chest for life-threatening injuries. After you expose the chest, you're going to check the rate and quality of breathing. They're going to give you a number and the quality of the breathing, as well as the SpO2. The O2 saturation. This will help you determine what type of O2 therapy you're going to provide your patient. So if, let's just say, the rate and quality of this patient is 18 and normal, and they have an O2 saturation of 97%, obviously they're not going to need some oxygen on there because they're breathing adequately. You still have to verbalize that you are going to you're not going to give oxygen to your patient since they have adequate breathing, okay? Because not everybody needs oxygen. Well, what about if they're 22, showing signs of mild respiratory distress and an O2 saturation of 93%? Then you would say, I will provide oxygen therapy using nasal cannula at 4 liters per minute since it's a mild respiratory distress. Or if the patient doesn't tolerate, I'm going to use a non-rebreather mask at 15 liters per minute. So you have to talk about all these 3 components. Don't just skip O2 just because you think that they have adequate breathing. It has to be talked about, okay? After that, circulation. For circulation, you need to assess for profuse bleeds, okay? Scan from head to toe what are the profuse bleeds, the rate and quality of the pulse, okay? And then your skin CTC. This will give you a sign if your patient is experiencing signs and symptoms of shock. The T stands for treatment for possible shock, okay? Treat for shock, okay? And you do that by covering them with a blanket, as well as dignity purposes, okay, plus dignity. Again, you don't have to write down all these things that I'm now writing down. This is just for me explaining it to you. Please do not worry about writing everything that I'm typing right now. Just remember the first few parts that I type, okay? I'm just typing this to explain it to you. After that, your P. Your P is basically the priority for your patient. This is going to be whether it's high or low. That's it. Those are the only 2 possible things that you're going to get. So starting from age, sex, all the way up to here to the priority, it should take you about a minute to a minute and 30 seconds. That's all that it really should take you. Then you're going to jump right into your secondary assessment, okay? So for your secondary assessment, ask the questions in order without changing anything. Okay, do not jump back and forth, please. It's going to confuse the evaluator, and you might miss a 1 point that you might actually need in order to pass medical. So, O, onset. Okay, O stands for onset. What were you doing? Okay, that's the proper question. What were you doing when this happened? Provocation, anything that makes this better or worse. Okay, that's basically your question for this one, or worse. Okay. For quality, can you describe the pain to me? Okay, you want to describe the pain in your own words. Radiation, where does it hurt and does it spread? S, severity, on a scale of 1 to 10, 10 being the worst, how bad is your pain? Okay. And then T, time, when did this start? When did this start? Then you jump right into your allergies, okay? Your ample. So for your ample, you say allergies. Are you allergic to anything? M, are you taking any medications? P, past pertinent history. Has this happened before? Any medical conditions that I need to know of? Conditions, okay? Let me just shrink the font here real quick so that you can still see everything that I'm writing down. There we go. Conditions, good. Then L, last oral intake. What did you eat and drink? How long ago? Or did you have anything to eat or drink and how long ago? However you want to phrase that. And then E, events leading up to. Anything out of the ordinary? Or you can simply ask, what were the events leading up to this? Okay. Clarifying question. Clarifying question. The best question to ask for this is, have you done anything to help you yourself out? Or have you taken anything for this condition? Because this clarifying question will basically give you what this medical assessment is all about. Maybe they've already taken 2 nitro. Oh, this is probably a cardiac emergency. Maybe they already took 1 puff of their inhaler. Or maybe they already they're going to tell you that they don't have a prescribed nitro or a prescribed inhaler. Clarifying questions is a very important aspect, even though it's not a critical hit. It will be a very important thing to determine the rest of your medical assessment. Okay. So after that, your focus physical exam. For your focus physical exam, a lot of you are missing this. How do you know what to do with your focus physical exam? Well, let's go back to Let's go back to our OPQRST and our ample. Look at your OPQRST and your ample, especially your OPQRST. Based on the based on the chief complaint, their radiation, okay, of where it hurts, okay, and also their past medical history, this will all tell you what you need to examine. For example, their chief complaint was shortness of breath. They told you that their chest hurts and it spreads on their neck and their jaw. Obviously, for your focus physical exam, you're going to assess the chest by doing decap BTLS as well as the neck and the jaw. What else can you do? Always, I'm going to type this in. Always auscultate for all of this, okay? Even though you think it's nothing, always auscultate the long sounds, and you already know how to auscultate, right? Mid-clavicular, clavicular, mid-axillary, okay? So that's for your focus physical exam. You need to do one, okay? You need to do one, okay? After that, your baseline vital signs. Okay, so you already found out what was going on outside your patient. Now it's time to find out what's going on inside. HM1, why is there 1 and 2? Well, your 1 signifies the first one that you actually have to get the BP, the pulse, the respiration, the CTC, and the eyes of your patient. Okay, from your actual live patient, from another detail airman or sailor or whoever is there. It's going to be a live patient. Then once you're done getting the live vital signs, this number 2 signifies the scenario. You have to ask for the scenario vital signs. If they don't give it to you, you need to ask for the scenario vital signs, because the first one is just to test whether or not you know how to take vital signs, and the second one will determine the rest of your scenario. Okay. So after you've done your baseline vital signs, now it's time to come up with a field impression. Field impression is basically possible what? Possible altered mental status, possible cardiac emergency, possible asthma attack, possible suicidal ideation. So why am I starting with possible? Because you never diagnose. As EMTs, we've never been authorized to diagnose. This is why you started with possible. After that, you call a medical direction for permission to intervene and transport. Okay, you need to ask permission to intervene and transport your patient. And then intervention. I gave y'all a sheet, okay, that has all the interventions. You need to walk us through there. Okay, you need to walk us through how you're gonna intervene step by step. For example, an epinephrine. Epinephrine is a prescribed medication. So to intervene, I'm gonna go ahead and verify my patient's 5 rights. Right patient, right? So if it's a prescribed run, right patient, 5 rights. If needed, 5 rights. Right patient, right route, right time, right medication, right dose, okay? Plus the expiration date. This is if it's prescribed. If it's not prescribed, then all you have to do is check the expiration date, yeah? And then epinephrine, 5 rights, expiration date. I'm also going to go ahead and have my patient hold their auto-injector epinephrine, take off the safety cap, go ahead and assist them in injecting it to their mid-lateral thigh, hold it there for about 10 seconds, remove it, and then after that, dispose it into a biohazard container and transport my patient immediately. Notice I said transport. After every intervention, you need to transport your patient, or else they're just going to stay there and their condition might get worse, okay? After you transport your patient, you're going to reassess. You're going to reassess your patient using the VIPS acronym. First, you're going to reassess your vital signs. How often? Is it going to be 5 minutes or 15 minutes? Demonstrate how and when. En route, I'm going to reassess my patient's vital signs, 5 minutes, because they're unstable. You're going to ask again for your scenario vital signs. You don't have to retake it on your live patients. You just have to ask. After that, you're going to ask for, you're going to reassess the interventions for about 2 minutes, right? That's the timeline. Interventions for 2 minutes. And you're going to ask your patient, how are you feeling? This is an important concept, because what if they don't feel better? Okay, what if they don't feel better and you still have 2 doses left and your reassessment vital signs show you that the patient is still in a crappy condition? So this 2 right here, the reassessment vital signs and intervention, will basically give you a clue, can I still give a second dose? If you are required to give a second dose, if you can still give a second dose, always go back to call medical direction and transport. Okay, and then you're going to walk through the intervention again and then reassess your VIPs. Okay, so reassess interventions, reassess primary and secondary assessment. Okay, that's all you have to say. I'm going to reassess vital signs, 5 minutes, and you're going to get, and then you're you're going to reassess vital signs for 5 minutes. There's my clicker. 5 minutes, blood pressure, pulse, respiration, CTC, and ice. And again, you're going to ask for this. And then your intervention, 2 minutes, ask your patient, how are you feeling? And then your primary and secondary. Most of the time, if they say they're feeling a lot better, there's no need to administer a second dose. And even if they say they don't feel good, think about it. Can I still give something for this patient? Remember, you only have maximum doses for each of this medication. Look at your intervention sheets. After you're done with that, you're going to say, I am now ready to give my verbal report. And then you're just going to read these ones with stars. The age of your patient, the sex, the level of consciousness when you got there, what was the chief complaint, what was important on the OPQRST, what was important in the ample, what did you find on the focused physical exam, what were your scenario baseline vital signs, okay, scenario baseline vital signs, what was the intervention you provided, what was the reassessment vital signs, and what was the patient's response to it, okay? All those with stars right there are the ones that you need to do for your verbal report. And then you're going to say, at this time, I am done. So that's basically all your medical assessment. Okay. Hopefully that's a little bit more clear to you of what needs to be on there. And again, please don't write down these things that I just typed. Just typed in the very beginning. Okay, the very beginning that I showed you: the age, sex, GLC, ABCTP, OPQRST, ample, CQ, FPE, BVS, and write down your baseline vital signs, field impression, call MD, intervene plus transport, intervention, reassess, VIPS, and then verbal report. Okay, so hopefully that made a lot more sense for everyone. And if you have any questions, please just let me know when we see each other tomorrow in class. Okay, other than that, have a good night, everyone, or day or afternoon, whatever time you're watching this video. Ciao.